is Dr. Ruchika Sood, your orofacial pain and temporomandibular joint disorders consultant. The name of the company is Neocare Headache and Facial Pain Relief Center, and we are based out of Navi Mumbai, Bandra, and Chennai.
Hi, I'm Dr. Shilpa Acharya, consulting physiotherapist in Sai Medic Hospital. I look after all kinds of pain along with Dr. Ruchika Sood.
Ma'am, can you tell us about facial pain management to audience? What is facial pain management? Can you tell us?
Orofacial pain essentially means any pain which happens in the face of orofacial area. This encompasses any kind of muscle pain which could happen up to your shoulders, and any kind of nerve pain which can happen in this part of your face and neck. It means any kind of problems with this joint, which is called as a temporomandibular joint, and any kinds of headaches like migraines, tension type headache, or any kind of neck cervicogenic headache, which means the head with pain which comes from your neck.
Ma'am, can you tell us more about arthritis and the types of stages?
Arthritis actually means degeneration of the bones. It can happen in all your major joints of your like the knee, the back, and the shoulder, and also with progression can lead to the smaller joints. There are two types of major qualification of the arthritis. Is the osteoarthritis, which happens with the bones, and the other one is the rheumatoid arthritis, which is includes even the vascular one. Osteoarthritis is the more common kind of arthritis which we get, which is common nowadays. There are 4 stages: grade 1, grade 2, grade 3, grade 4. Grade 1, grade 2 can be seen normally, and grade 3, grade 4 needs intervention, sometimes even surgical intervention.
Ma'am, do you think TMJ is the second most disease in India people are suffering from?
It is true that the epidemiology, according to the developed world, like in the United States, is very high, and in countries like Brazil, is about 40% of the population suffering from that disorders. But in India, we have no epidemiological studies done on the incidence of the disease so far. But considering the data from the other world and what I see regularly in our practice, yes, definitely TMJ looks like to be the second most affected joint of human body with pain problems.
Ma'am, what are the different types of exercise you recommend for the people who are suffering from arthritis?
In the early stages of arthritis, we could do any specific muscle or joint pain exercises. Whereas if the stage increases and the pain increases, it would need physiotherapy intervention along with exercises and medication. But exercises would more or less be to strengthen the muscle and increase the mobility and flexibility of the joint.
If someone is suffering from facial pain, can it be cured or it can be managed?
When we talk about pain, we talk about a big array of problems. When we describe pain, we look at it as an emotional and sensory problem. So, pain can be of 2 types. It is acute pain or it is chronic pain. Acute pain usually has a reason and is a warning sign of something going wrong in human body, and that has to be corrected. And when we talk about chronic pain is a disease in itself. And when we talk about orofacial pain problems, we are talking about chronic pain which has stayed in your body for more than 3 months of time. These problems are management problems.
And how long can we sit in front of television?
See, our lifestyles have become as such that we are sitting in front of not only the television, in front of the computer screen, in front of a laptop for more than 80% of the day. So, which is not very healthy for a healthy lifestyle. What we should be doing is every 2-3 hours, get up from one position, change, do some movements, and then come back and sit in the position. So long sitting in any position, even in front of the laptop or in the TV, is not advised at all.
If someone is suffering from acute pain, what kind of lifestyle modification will help you reduce the pain?
When we talk about acute pain, we need to focus on knowing the reason for the pain and treating the cause of that pain. Like I said, acute pain is usually a warning sign of something going wrong with our body and requiring attention and treatment. Lifestyle modifications are more a requirement of chronic pain. For example, some people who suffer from migraine, which is a type of headache disorder, they identify their triggers, which may be weather change, which may be certain kind of smells or something, and they restrict their exposure to that. They will correct their problem by certain percentage. There may be people who spend long hours on the computer screens, and their job profile needs them to work on the desk for a very long time, and this induces some kinds of degenerative changes in the neck and causing another headache or jaw pain or TMJ problem. And these patients will improve a lot by working on the lifestyle modifications. The lifestyle modifications and the dietary modifications or the correction required for each chronic pain patient is customized. There cannot be one size fits all. That's the crux of pain management, because we have to understand what's happening with the person, what is the pathophysiology of what is happening in that particular person's body, and how do we manage it medically to ensure that the person lives a good quality of life.
Now, what can anyone do that will help to speed up their recovery?
Firstly, we need to stop having a sedentary lifestyle. We really need to start working on some activity, some exercise to do, even if it's just walking or swimming or jogging, needs to be done so that the pain or the early arthritis which sets in kind of slows down.
Do certain foods or fragrance trigger pain?
Which is true. There can be certain type of foods, there can be certain type of fragrances which can trigger pain, but for some individuals where olfactory nerve is involved in the mechanism of the pain, but not for everyone.
Now, if you came to know about early arthritis, what are the precautions we can follow?
See, early arthritis, if you're talking about the back or the knee, which is a very common kind of arthritis which occurs, the first thing which we need to do is stop lifting weights, especially in the wrong posture. When we lift from down to up, that needs to stop at any single specific posture for a long time, like sitting in a place for a long time or bending for a long time. That needs to stop, and they need to break all their activities and do it. And no sitting cross-legged. That's the major cause of knee pain.
Now, my thumbs are swollen, red, and there is a whitish layer on them. What possibly could be the reason behind it?
When we have this kind of condition in our mouth, it is generally the problem with the gums, which could be something like gingivitis or periodontitis. And these are very treatable problems. For these problems, you need to see your dentist. And if they are associated with the pain which the dentist cannot resolve and it lasts for more than 3 months, it is then that it is an orofacial pain problem.
Can you brief our audience about the best posture for our body?
See, a best posture is something where all your joints are actually in the most optimum position. Preferably ergonomically, 90 degrees is your most ergonomic position, where your back support is at, you have a complete back support, your hip is bent at 90, your knee is bent at 90, and your shoulder and your laptop is at your eye level, which is not very possible every day. So, preferably at least 10 degrees up and down should be fine, but 90, 90, 90 is the optimum level of sitting.
Ma'am, if someone is having pain in lower jaw or feeling like writing going off their face, what can it be related to?
It could be related to any type of orofacial pain problem. Most commonly, people talk about trigeminal neuralgia, which is like an electric bolt. But more and more, I see people who have undergone treatment for trigeminal neuralgia, undertaken many surgeries to find a cure for trigeminal neuralgia, but not finding any relief with the pain. Orofacial region is complex region, and these diseases are a diagnostic challenge because it's a very small anatomic area and has many pathophysiologic mechanisms contributing to the pain. So something like an electric jolt could be coming from many different reasons. It needs a complete analysis going over patient's history, and the diagnosis can only then be established.
Ma'am, last question for you. What are the different options to ease joint pain and support strength?
Joint pain can be eased by medication, by physiotherapy, and especially the upper cervical and all that pain normally is because of the TMJ and all the other orofacial pain. So it needs a specific pattern of treatment. It's not only physiotherapy, it's not only medication. It is a combination of all of those together which will give you pain. So you need to consult each one correctly and follow what they're saying, and then it will help.
And last question for you. Can facial pain cause a person to be depressed or insomniac?
Yes, this is a very, very tricky question. And almost every time when I'm questioned, this is asked that can pain be psychological? My answer remains the same: no. A big no. Pain is not psychological. Pain has its reasons to exist. Something going wrong in human wiring, and something chronic pain is a disease in itself. But when you suffer for a very long duration, can that create depression? Can that make you feel out of focus with life? Can that give you sleepless nights? Yes, it can. What came first, chicken or egg? That's an unending debate, but pain per se has its origin, has its reason, and in today's time, it's very much possible to manage and live a very good quality of life which is pain free.
Thank you, ma'am. That's it. Thank you for spending the time.